Welcome to Logical Ayurveda. Today we are going to discuss in detail about Pratisyaya with special reference to allergic rhinitis. Because of the sedentary lifestyle, improper food habits, junk foods, lack of exercise, people are more prone to allergic rhinitis in this generation more than ever, especially because of lack of exercise. There is a quote for allergic rhinitis which says, allergic rhinitis is a condition when your nose does more running than you do, which clearly states it's absolutely because of a basic lack of exercise. If someone wakes up every morning sneezing and with a stuffy nose, then gets better during the day, to have that same misery repeat again next morning, that is allergic rhinitis. This disease is a true test for Ayurvedic physicians because of the different dosha avasthas involved. Once you master the art, we can beautifully cure a lot of people, while contemporary science is absolutely clueless to how to cure it. It is basically a kapha dosha involved vyadi with different dosha anubandhis, with pitta or vata dosha anubandhis. So, why it is kapha dosha involved vyadi? You will find most of the patients sitting inside the home, not getting exposed to sunlight, with no exercise whatsoever, eating oily fried foods, indulge in milk and dairy products all through the day, sitting in AC with marbles all over the home, and usually in climate like Bangalore. So you, with all this combination, deadly combinations, it is wonder if they follow all these nidanas, they don't get allergic. We have to wonder if, because we follow all these nidanas, it is a wonder that we don't get allergic rhinitis. Very often we find it difficult to treat allergic rhinitis because we don't understand the dosha behind it. There will be episodes of sneezing, nasal blockage or catarrhea. Catarrhea is running nose, and that which aggravates in the morning, and repeated upper respiratory tract infection. Sometimes even the infection moves to tonsillitis, tonsils and bronchus, causing tonsillitis and bronchitis. So let us go to different dosha involvement in that. First, let us discuss about Kaphaja Pratisyaya in detail. Kaphaja Pratisyaya is all those symptoms of sinusitis because of the cold nidanas, because of the Sheetha nidanas. It is Kaphaja Pratisyaya, it's associated with Shiro Gaurava, heaviness of the head, profuse nasal discharge, thick mucus which is coming out of the nose, increases in the morning, that is Kaphakala, increases after taking the food, increases during the cold season, increases after taking oily food, increases after taking head bath, applying oil aggravates it, feeling good after taking warm foods, feeling aggravated when we take any cold stuffs or oil fried foods, and finding relief with tea or coffee. And you can also find symptoms of tenderness in frontal, temporal, occipital sinuses. Sleeping under the fan increases it, cold breeze increases it. All these symptoms are symptoms of Kaphaja rhinitis. Basically, increase in Sheetha Snigdha Guna Vritti causes Kaphaja Pratisyaya Vritti. So what is the treatment? Obviously, as we discussed in several diseases before, opposite of Sheetha Snigdha is Ushna Ruksha. So we have to give Ushna Ruksha treatment to the patient. Most of the time, Kapha dosha involvement only will not be there, a little bit of Vata Anubandha will be there. So giving Ushna Ruksha for a long amount of time, the Rukshata increases Vayu as well. So while giving treatment of Kaphaja Pratisyaya, you have to give treatment for 1 week, then review the patient, then change whenever it is necessary. Severe Kapha involvement, we can use Vyagradi Kashayam. Dashamula Katatraya Kashayam is also equally good in treating Kaphaja Pratisyaya, provided all the symptoms of Shira Gaurava, nasal blockage, that which increases in the morning, increases after finding all the symptoms of Kaphaja Pratisyaya, we start this treatment. Vyagradi Kashayam is excellent in treating that. Dashamula Katatrayam Kashayam or Kashayam tablets. Gorochanadi Guliga and Vayu Guliga is also very efficient in treating the Kaphaja Pratisyaya. When there is polyp involvement, nasal polyp involvement, or when there is a tonsil increase in the tonsil size, etc., then we can use KANCHANARA GUGGULU. Arishta can be used, Arishta like Kanakasubha, Vasa Arishtam, Dashamula Arishtam, or Nimba Amritasum, any of those according to the condition can be used only when you are so sure that it is Kaphaja Pratisyaya, when you are so sure that there is no Pitta involvement. Using Arishta when there is Pitta involvement definitely increases the disease. So one has to be very careful in choosing the Arishta. So Talisadi Churnam is also excellent in treating the Kaphaja Pratishaya. The one which can reverse the Samprapti of Kaphaja Pratishaya is Agastya Rasayanam. Agastya Rasayanam is a must prescriber for all the patients of chronic sinusitis and all those spectrum of symptoms that fit under Kapha Pratishaya. Why choose Agastya Rasayanam, especially in the pediatric diseases? Because the children who is having this Kaphaja Pratishaya will not spit the mucus out of the mouth, or they won't regularly drain it through the nose. So it's very important that we take it through alternate pathway. Agastya Rasayanam is a beautiful medicine because it does Vatanulomana and takes all the mucus through the defecation. It's a very beautiful medicine in challenging type of cases because it can remove kapha through the alternate route, not through the nose or the mouth. It can remove kapha, thereby achieving permanent Vatanulomana, thereby reversing the Samprapti of Pratishaya. That is why Agastya Rasayanam is such a beautiful drug. You should definitely use this. You can use Agastya Haritaki or Vyagri Haritaki, Trikatu, Talisadi Churnam. Every drug that is Ushna and Ruksha can be used in this disease, and the list is so much bigger, and I've used only the important medicines that I have given in practice. So now we will discuss about Pithaja Pratishaya. In Pratishaya, as I already told, the basic dosha is Kapha, Anubandha dosha is Pitta. So in Pithaja Pratishaya, the basic dosha should be Kapha, Anubandha dosha is Pitta. So how do you identify that there is Pitta Anubandha? In Pithaja Pratishaya, generally, according to my experience, sneezing will be more. It will be associated with itching behind the nose and palate, also associated with burning sensation of throat, sometimes nasal membranes, burning of eyes and redness of eyes, and repeated itching of the eyes are some of the symptoms, some of the indicators that can make us think that Pithaja Pratishaya is involved. Identifying Pithaja Pratishaya is not always easy. So many times a patient comes to us, we think that it is Pithaja Pratishaya and prescribe Ushna medicines. When we prescribe Ushna medicines to them and they get their Pratishaya increased, then we will think about whether Pitta involvement is there. Then we will ask all these symptoms. Sometimes in Pithaja Pratishaya, the mucus will be thick and yellowish. Some of the Pithaja Pratishaya patients get their sneezing and nasal discharge relieved after taking food. They will also be having associated Amla Pitta and other Pithaja Nidanas. In extreme Pithaja Pratishaya conditions, blood will be mixed with the mucosal discharge. Blood along with the mucosal discharge, the mind should first go to Pithaja Pratishaya, because in that condition, Ushna should not be given, or very carefully the medicine should be chosen. It happens because of eating oily foods and the kleda that is getting excessively increased in the body. To understand how kleda, so many times we tell kleda, but there is no clear picture of how kleda works in the body. So understand the picture of kleda, I will tell a very simple thing to the junior doctors just to get it. Just think, a person eats excessive pani puri, excessive spicy pani puri every day, the person will get gastritis. If a person eats excessive cold ice cream every day, the patient will have sinusitis. So what happens in the first case? The pitta is increased, the patient is getting gastritis. What happens in the second case? He eats cold ice cream, kapha is increased, he gets sinusitis. But imagine a person eats both. First he takes pani puri and then he takes cold ice cream. Something must happen, right? But both of that gets neutralized, hot and cold. So if you are smart enough to neutralize Ushna and Sheetha at the level of Koshta, body is smart enough to take those dosha, vitiated Pitta and Kapha, into Rasadhatu, causing the Rasadushti, thereby giving you Kushta. That is nothing but Kleda. Pitta and Kapha, when it gets together, that is called Kleda. That is a main cause of skin disease and Pithaja Pratishaya, etc. If you open Charaka and read the Nidana of Kushta, it will be very, very clear of alternate Nidanas, mixing with hot and cold items together. So that is how Kleda is formed. If a person eats lot of pani puris, he gets gastritis. If a person eats lot of ice cream, he gets sinusitis. If he mixes both and heats excessively, definitely it will cause Pitta Kapha vitiation, increase of Kleda in the body, thereby Rasadhatu Dushti, causing Kushta and Pratishaya. So now we can understand simple Nidana of how Pitta and Kapha are at a time involved in the same disease. To better understand this, you can go and study Ashtanga Hridaya Vasanta Rutu, where Vagbhatta clearly explains in the Vasanta Rutu, Skannatvanna or the icy structure of the Kapha is being destroyed or liquefied by Ushnata, by the Ushna that is increased. Thereby Kapha gets liquefied and then Kaphaja disorders happen mostly in Vasanta Rutu. It is a Kapha Prakopa Kala. So once you get a hold of it, definitely it is very easy to treat Pittaja Pratishaya. And most of the time when you give certain medicine and the medicine does not work, then you should always keep Pitta in mind. Why it didn't work? Because Ushna Guna will reduce Kapha, Ushna Guna will reduce Vata also. If it did not reduce to a person, because the medicine is given and the person sneezing or nasal discharge didn't reduce, instead it increased, then it may be Pittaja Pratishaya, and also it may be the person didn't follow the proper food regimen also, but you should keep Pitta in the mind. So coming to the treatment of Pittaja Pratishaya. So you can also say Ushna Guna of Pitta is increased and Snigdha Guna of Kapha is increased. So opposite of Ushna is Sheetha. Opposite of Snigdha is Ruksha. So we have to choose the medicine which is Sheetha and Ruksha because it is a Pittaja Pratishaya. Now, can we give Drakshadi Kashaya in this? Person comes to you with the Pratishaya, can you give Drakshadi Kashaya directly for him? No. Why not Drakshadi Kashaya? Because it is Sheetha and Snigdha. It will again increase Kapha. Can you give Vidaryadi Kashaya for the patient? Definitely no. It is again Sheetha and Snigdha. What can you give? You should choose some Kashaya which is Sheetha and Ruksha. Which is Sheetha and Ruksha? Tikta Rasa is Sheetha and Ruksha. You need to choose Vasa Guluchadi Kashayam, which is Sheetha and Ruksha. Guluchadi Kashaya, again Sheetha and Ruksha. Pachanamritam Kashaya, little bit Ushna but does the job in Ruksha. Amrita Shadangam Kashaya, again Sheetha and Ruksha. So now I am going to reveal you one secret. So many juniors have come and asked me, this is definitely a secret. So many juniors have come and asked me, sir, I don't get result in allergic rhinitis and all. What to do, sir? Patient comes every time again and week after week they are telling my sneezing is not at all reduced. My nasal discharge is not at all reduced. Every morning I wake up again the same complaint. Which medicine you are giving, doctor? I am not getting cure at all. So give me something to come out of this. Again I have to go back to English medicine, cetirizine or levocetirizine to come out of this for such patients. This medicine is Nishamrita from SDP pharmacy. In early stages of my practice, I also didn't get results in allergic rhinitis, be it Vataja, Pittaja or Kaphaja. I was not able to catch the doshas properly. And I also needed a symptomatic medicine where we can reduce the amount of sneezing in the patient in the early morning, where it becomes very irritating for the patient. So another Ayurveda doctor who is my friend introduced this medicine to me. This is Nishamrita of SDP pharmacy. It contains only 4 ingredients. One is Nisha, next is Amrita, Chandana and then Manjishta. And I found this because of its Prabhava or Tridosha Haraguna or whatever we can name it. It is excellent in reducing the bouts of sneezing in allergic rhinitis and give excellent symptomatic relief to the patient. It is one of the few dravyas where by Prabhava it acts. You can give in any case of allergic rhinitis and you will have results. So that is why I wanted to name it a secret medicine, and we was very successful in getting the results of allergic rhinitis by using this medicine. I hope you can also find it online and use it on patients and see the results, and you can come to know. I mean, there may be many similar medicines like that of different pharmacies, but what we found result is what we can tell you. So, coming to Vataja Pratishaya. So, how to understand Vataja Pratishaya? Simply keep in mind, Vata is like a monkey. Vata is like always Shala, moving from one end to another, which is constantly jumping from one end to another. Nasal obstruction. Nasal obstruction is the main symptom in Vataja Pratishaya. Whenever the patient comes with nasal obstruction, the first thing that comes to your mind should be Vataja Pratishaya. Sometimes, how did this Vataja nasal? Sometimes a nasal obstruction will move from left nose to right nose to left nose. Night left nose will be blocked, in morning right nose will be blocked. So which keeps on changing, which keeps on playing kabaddi with you is that which is Vataja Pratishaya. So symptoms like keep on changing. It's like sometimes lot of sneezing will be there, and sometimes sneezing will not be there, and sometimes a lot of nasal discharge will be there, and sometimes only dryness of the mucosa will be there. The person will feel lot of dry. Sometimes soreness of throat and loss of voice will also be associated. And simply to put, Vataja Pratishaya always moves from one symptom to another. So it is mainly you find it with nasal obstruction, and sneezing will be more in Vataja. In Pitta also it will be more, sneezing in Vataja Pratishaya also it will be more. And that which is sometimes nasal discharge will be there, and sometimes nasal obstruction will be there. That is how this altering symptoms in all diseases is always belongs to Vata. So Vataja Pratishaya, and sometimes Kafaja or Pittaja Pratishaya, when it is long standing, when it becomes more than 1 year, it always gets down to the Vataja Pratishaya stage. So before treating a Vataja Pratishaya stage, you should always inform the patient that, see, you have come to me in a chronic condition. You have had these symptoms, almost nasal obstruction, sneezing, nasal discharge. You have had the symptoms for 3-4 years. I cannot do magic within 1 or 2 months. So I need minimum 3 months of treatment, and then maintenance medicine like Chyawanprash for the next 6 months, and then only you will get result. For the patients, you should definitely tell this, because they'll be used to using antihistamines always on a regular basis. They'll have cetirizine for years together, they'll have levocetirizine for years together, and then you come one day, definitely stop cetirizine, levocetirizine, have some kashaya lehya, you will get result all over the night. That is what the patient expects. Definitely it's not possible. And if the patient insists that he gets result early, it's better to avoid such patients, because Vataja Pratishaya is not something which is of recent origin, and it cannot be cured by giving some mere 1 week or 2 weeks of medicines. It needs patience, and people who are Vataja Pratishaya along with Vata Prakriti, people who jump from one doctor to another, do not take medicines properly, please don't take such patients. They will also destroy our name as well. They are not ready to take for long term, and they are not ready to follow Patya. Definitely they will also damage your reputation as well. So Vataja Pratishaya is something that needs to be treated for months together. So Vata is SEETHA and RUKSHA. How do you treat SEETHA and RUKSHA? You give Ushna and Snigdha Guna. So how to give Ushna and Snigdha Guna? So what are the medicines that can be chosen? Amrutotram Kashayam is a very beautiful medicine according to the condition, because it contains Amrita, Haritaki and Shunti. What Haritaki does is usual reversal of the pathology. That is, Vata Pratiloma Gamana is cause of Samprapti of Vataja Pratishaya. Haritaki does the Anulom-Vilom of the Vata, thereby permanently curing the disease. So Amrutotram Kashayam or Amritotra Kashayam tablet has to be given on a regular basis. That gives most beautiful results. Shunti also takes care of the excessive nasal discharge and nose blockage as well, and Amrita takes care of the allergy. That is excessive kleda. So it's a very beautiful Tridosha combination, and Amritotram Kashayam handles all the particular symptoms at a particular point of a single point of time, and it is very beautiful medicine to choose in Vataja Pratishaya. What else I can choose? You can choose Vayu Guliga. They always tell for Vataja Pratishaya, Vayu Guliga, Ashalyadi Guliga. There is a medicine in Kotakal and other, that is called Ashalyadi. that medicine is also very beautiful in treating nasal blockage. Usually when the patient comes, I usually choose Vayu Gulika Rashalayadi to relieve the nasal obstruction. See, nasal obstruction can also be structural. It can be because of deviated nasal septum. Vata kind of nasal obstruction is that which shifts from one time to another. Sometimes it will be left nose, sometimes it will be right nose, and it's not structural. It is a functional. When Vataja Pratishaya is involved, the blockage is always functional. It's not structural. So you need to understand that. So the basic prescription will always contain Amritotram Kashayam, Vayu Gulika and Nishamrita. If excessive sneezing is there, definitely. I told all the doshas I use Nishamrita. There is an open statement. This is a Vyati Pratyanika treatment. And the combination, the Amrita Arishtam, Vasa Arishta and Bala Arishta. I don't usually use Arishta in Vataja patients. In very rare case I use, because Arishta again is Ruksha. It will increase the Vata. So Amrita Vasa Bala I will give whenever the conditions use. I will not give regularly. So the usual prescription is Amritotram Kashayam, Vayu Gulika and Nishamrita. And the most beautiful prescription, the Vyadihara, not Vyadihara prescription, the Hetu Vyadihara prescription is Chavanaprasha. Chavanaprasha is a perfect definition of Ushna and Snigdha. It contains all the drugs in that treat which is Ushna enough to treat Vata and Snigdha enough to treat Vata. So Chavanaprash Kashayam, I will only recommend Imcorp's company Chavanaprasha or AVP company Chavanaprasha. I also have made a video on that, and it is very beautiful, Chavanaprasham. So in treating the allergic rhinitis, long-standing allergic rhinitis, wherever nasal symptoms is involved, wherever the symptoms jump from one place to another. See, it's very simple. You have excessive nasal discharge, and you identify that it is a Kafaja Pratishaya. There you have to give Agastya Rasayana. You identify that it is Vataja Pratishaya, keeps on shifting from one direction to another. There you have to choose Chavanaprasham. It's very simple. So whenever Amritotram Kashaya, Vayu Gulika, Nishamrita, etc., I'll be using definitely for minimum of 45 days to 3 months. Minimum of 45 days to 3 months, and then Chavanaprasha again for 3 months. Only Chavanaprash I will continue. If the patient gets all the symptoms subsided, I will continue only Chavanaprash for the next 3 months. Because Vataja Pratishaya is not something that can be easily treated, and even it jumps. When you give medicine, suddenly the patient will feel a lot of relief, but after 1 week they will get same symptoms again. So another point to consider is if the patient is having long-standing use of, they have a habit to take cetirizine or levocetirizine, it is very, very difficult initially to leave cetirizine or levocetirizine and give treatment. You have to find a way to taper these. For example, they are taking 10 mg, you have to give 5 mg tablet daily, and use the tablet only when the symptoms subside. Use the tablet only when needed, only when increases, because Vataja Pratishaya, it jumps. It suddenly reduces and it suddenly increases one day. The patient will follow some pathya, they will go have some ice cream, suddenly SEETHA guna increases. So much watering of nose will be there. So that time definitely they have to take cetirizine or levocetirizine, because they are used to taking antihistamine. For such patients, doctor has to have patience, and they have to educate the proper usage of cetirizine and levocetirizine, but ultimately we can get rid of it. And sometimes it is for at least 2% of the patient, it is almost incurable to treat Vataja Pratishaya. There are definitely cases in which I failed miserably to treat Vataja Pratishaya because it is long standing. It is more than 5 years and 6 years. Tell the patient, I can only try. I cannot tell you that I can definitely give you result. So always protect yourself before saving the patient, because they will use your word as an advantage at last. Chronic long-standing patients who use cetirizine for 6-7 years, definitely the dosha won't come down within 2 months. It's very difficult to treat them with sometimes with all possible things, nasya, etc. It's still very difficult to deal with them. So this is the end of Vataja Pratishaya. And coming to the diet in Pratishaya, you definitely ask the patient not to take excessive cold items or excessive oily foods, etc. And excessive use of dadi in night also can cause Pratishaya. And you can refer all of the Nidanas and Charaka, and you can advise to the patients. Thank you.